My name is Dr. Dawn Scantlebury. I am an interventional cardiologist and the medical director of Cardiovascular Disease Prevention and Rehabilitation at the Heart and Stroke Foundation of Barbados. That's a mouthful. What that means is that I direct their cardiac rehabilitation program where patients who have had heart attacks, stroke, and who are at risk for the same come to engage in the prevention program. I'm going to speak to you today about a mixture of things: the non-communicable diseases, heart attacks, how to avoid heart attacks, and a little bit about COVID and where COVID fits into all of this. The non-communicable diseases include conditions such as hypertension, diabetes, heart disease, stroke, cancers of all types, and then lots of other conditions, things that aren't included under the umbrella of the communicable diseases or infectious diseases, of which COVID is one, and also maternal and child health problems as well. The NCDs, even though it seems like they have kind of fallen by the wayside over the last few months, they have also come to light because of the fact that patients who have NCDs are actually at higher risk for severe COVID disease. So if you have hypertension, poorly controlled hypertension is high blood pressure, your risk for having a bad outcome if you develop COVID is higher than the average person. Same thing with diabetes. Here in Barbados, most of the patients who died from COVID actually had diabetes. So it's important for us to understand that even though the focus and the strong focus is not on the NCDs right now because we're thinking about COVID, but we still need to understand that these things are very important because they impact so many aspects of life. So the cardiovascular diseases, as I was saying, include things like heart disease, such as heart attacks, heart failure, abnormal heart rhythms, and then all vascular disease, including the vessels of the brain. So if they're affected, you can get stroke and dementia. Vessels of the kidneys, and vessels in the legs, where you get peripheral vascular disease. So diabetic foot disease is a cardiovascular disease. The main risk factor for the cardiovascular diseases, or the main risk factors for the cardiovascular diseases, are high cholesterol, diabetes, hypertension, smoking, and a family history. So if you have even one of those conditions, your risk for developing one of the cardiovascular diseases is going to be higher than a patient without them.